If your coworker gets burned, do you know what to do? These are important questions that need to be addressed before they actually happen, so that you know how to respond in the situation and also not make it worse. So for managing burns, one of the first responses should be to stop the burning process. Seconds count. The sooner you can stop the burn, the less the injury will be. Second, you want to cool the burn, but don't overcool the patient. Cooling the burn will provide pain relief, but if you cool too much, it can actually cause hypothermia. By providing pain relief and patient comfort, you will help provide confidence to the patient that everything is going to be okay. You also want to cover to protect against contamination. When a burn happens on flesh, it's exposing raw flesh that can be very susceptible to infection, so you always want to make sure and cover it as soon as possible. And as always, ensure your own safety. So when managing burns, there's some do's and don'ts that you want to think about. You do want to call 911 and turn the power off and de-energize the line. You also want to verify the threat. You want to make sure that nothing gets contaminated, including yourself and others. Have the victim lie down if possible, and apply first aid as soon as you can. So some of the things you don't want to do is become a victim yourself. You don't want to move the victim unless it's absolutely necessary to get them out of harm's way. And also, you don't want to remove any clothing. The clothing can become attached to the burned area and tear the skin off as you try to pull it away. Make sure you don't use ice, cold water, or a fire extinguisher unless it's absolutely necessary. If this is all you have, of course you want to use it, but just remember it can lead to frostbite. So for treating burns, you have a few options. The first one is a dry dressing. That'd be like these gauze pads. The next is a wet dressing, which is these gauze pads, and then using a saline solution that you could pour on the gauze to make it a wet dressing. The benefits of a wet and dry dressing is that it slows the burning process, provides some pain relief, and it covers and protects the contaminated area. It also won't irritate the eyes, nose, or throat. Some of the shortcomings of dry and wet dressings is it evaporates quickly, it can cause hypothermia, usually just have a limited supply of saline solution, which can dry out, and it's difficult to remove for debridement. It also provides limited pain relief, and it's difficult to manage on the face and hands. Another option is a hydrogel dressing. This is made by water gel, and it's very portable and easy to use. It dissipates heat away from the burn area and cools and soothes, providing pain relief for the patient. These kits come with a variety of different applications, such as this one for the face, and also a full blanket for a full body burn. If you're investing in first aid, FR clothing, and high voltage PPE, you should invest in the best for first aid burns as well.